Did you know that over 80% of hospitalized patients receive medication during their stay? Now imagine the complexity of managing these drugs, their interactions, side effects, and the individual patient responses. Welcome to the intricate world of clinical pharmacology. First on our list is drug interactions. Picture this: two substances, each with their own intended effects, but when combined, they interact in unpredictable ways. These interactions can alter the efficacy of the drugs or even lead to adverse effects. Moving on, we delve into pharmacokinetics, the journey of a drug after it enters the body. This explores how drugs are absorbed, distributed, metabolized, and excreted. Ever heard of terms like bioavailability, half-life, and clearance rates? These are the keys to understanding this process. Next, we flip the coin to pharmacodynamics. This is where we examine how drugs exert their effects on the body. We're talking about mechanisms of action, receptor binding, dose-response relationships, and everything in between. But what happens when things go wrong? Enter adverse drug reactions or ADRs. It's important to recognize these effects and manage them effectively. Now consider this: every individual is unique. Age, gender, genetics, and health conditions can all influence how a patient responds to a drug. This is why understanding individual variations in drug response is critical. Dosing and titration is up next. Determining the right dose is a fine balance. It's based on patient weight, age, renal or hepatic function, and therapeutic goals. And how can we forget about drug safety and monitoring? Staying updated on drug safety alerts, black box warnings, and guidelines for monitoring patient responses is a must. Next, we have drug formulations. Tablets, capsules, injections, they all have implications for dosing, administration, and patient adherence. Ever wondered how a drug goes from concept to pharmacy shelf? That's where the drug approval process comes in. It includes preclinical testing, clinical trials, and post-marketing surveillance. Lastly, we arrive at evidence-based medicine. Clinical decisions should be based on the best available evidence from randomized controlled trials, systematic reviews, and meta-analyses, considering both benefits and risks. In summary, clinical pharmacology is a multidimensional field. From understanding drug interactions, pharmacokinetics, and pharmacodynamics, to recognizing adverse drug reactions, individual variations, and mastering the art of dosing and titration, it's a vast domain. Add to it the layers of drug safety, formulations, the approval process, and evidence-based medicine, and it becomes a labyrinth of knowledge. But remember, staying updated with the latest research and guidelines is essential for providing safe and effective patient care. So buckle up and dive into the fascinating world of clinical pharmacology.